Hi, I'm Dr. Eric Westman, and your patient probably asks you to watch this video. This is for doctors. I give this video presentation to other doctors, health systems, conferences interested in diabetes, obesity. I'm Dr. Eric Westman. I work at Duke University. I've been there since 1990. And I'd like to just share with you an update on where the keto diet is today. I'm past chairman of the board of the Obesity Medicine Association, which is the largest group of medical doctors that treat obesity. And then I'm a co-founder of Adapt Your Life, which is a product company and education company. I also am co-author on the New Atkins for New You, Keto Clarity and Cholesterol Clarity. You may be confused about the keto diet because there is confusion today with three main reasons, all these coming together. The ketogenic diet for epilepsy you may have heard of. It's a treatment for childhood refractory epilepsy now being tested in adults. The paleo-primal movement made a focus on real foods and foods that were low in omega-6 fatty acids because of the inflammation, but it was not quite as low in the carbohydrate as the low carbohydrate, high fat, or low carbohydrate ketogenic diet, which is the focus of the research that I've done at Duke. So when I talk about the research about a keto diet, I'm talking about LCHF, LCKD, or it's also called lazy keto, dirty keto. I don't know the role of intermittent fasting, exogenous ketones, because those haven't been tested as much as just the low carbohydrate ketogenic diet has. And we were all taught that eating fat was bad, so I'm dealing with that. Doctors still are in the old paradigm. Everything gets better, but you still blame the diet and that it's going to be bad for you. So at least compared to 10 years ago, 20 years ago, I'm seeing a lot of doctors who at least are accepting that things can get better when people don't eat carbohydrates and they don't push back and tell their patients to not do it as much anymore. So we got involved in the studying the low carb diet back in 2002. It turns out, looking back, there was a 22-year taboo on publishing and doing research on the low carb, high fat diet. You may remember John LaRosa, former leader, maybe still leader in the Heart Association. And so they basically said eating fat was bad based on a study of 24 people. Looking back, it's chilling to see that such a small study could have a big effect. It's not the only study that was involved, but you have to understand that the opening of the research by Jeff Volek's group and our group, Will Yancey and I at Duke, only started in 2002. And most of us were trained in that 20-year period where the idea of telling someone to eat fat was taboo. It was not acceptable. So we've come a long way. The first studies done in the 2003, 2004, 2005, these are all randomized controlled trials of people with the sample sizes here. And it's not that low-fat diets can't work. It's that low-fat diets work, but low-carb diets work better. And so these were the first rounds of studies that, for me, kind of cinched the idea that it was okay for me to use a low-carb diet. There were no major adverse effects and adverse events in these studies. No major even complications were observed. So I started using the diet in clinical practice, but the research kept going on. Now all around the world, studies have been done. This is a meta-analysis from 2013 of all of the randomized trials over 12 months. And it's not that low fat can't work, it's just that low carb diets on average work better. So the summary favored the very low carbohydrate ketogenic diet here. So a lot of studies have been done. In fact, now going beyond just head-to-head low carb, low fat, my colleague Will Yancey at Duke decided to study a low carb diet compared to a diet and a drug, a low fat diet with orlistat, a fat blocker, and they were similarly effective. This shows the average and then the individual effects. And what is pretty remarkable is, and I see this in clinical practice, is that in 1 year, someone can lose 30% of their body weight and do it safely by eating food with no pills, no products, no surgery. So when you compare it to other ways of doing things, this is a pretty attractive way to do it. If you put all of the studies together and compared the statistically significant ones for the treatment of obesity, low carb wins 31-0. And this information is at the Public Health Collaboration of the UK.org, and this body of evidence surpasses the FDA requirements for approval of a drug. So if it was a drug, it would be FDA approved, safe and effective. Organizations have included low carb diets in their guidelines. This is the guideline algorithm from the Obesity Medicine Association, and the very low carbohydrate diet under 50 grams a day with or without nutritional ketosis is part of that algorithm guideline. Switching to diabetes, we've known for a long time that what you eat affects diabetes, and a low carb diet can actually reverse diabetes. This is the textbook of medicine by William Osler from 1923. They didn't have insulin in common practice then, and it's a 10 gram per day carbohydrate diet for the treatment of obesity and diabetes. It got lost from clinical use, but still the number of studies done, the number of studies reflected in the node here, and then the sample size and the line size. Of course, low-fat diets have been studied more than anything, but for diabetes, the low-carb diets have been studied as much. There's as much evidence for low-carb diets as there is for really any other diet for diabetes that we have today. And a major study that wasn't included in that previous study, the Hallberg paper, actually took 262 people with type 2 diabetes and obesity, made sure they were in nutritional ketosis. They got a kit where they were measuring the blood, they were getting on a scale, and that was Bluetooth back to the researchers, and they found that the A1C reduced from 7.6 to 6.3% with a body weight change of 14 kilograms. And the most remarkable thing, if you don't use this kind of diet, I see it all the time, is that insulin therapy was reduced or eliminated, and you got the hemoglobin A1C reductions. So it's a pretty remarkable tool to reduce blood sugars, to reduce body weight. For most type 2 diabetes patients, the obesity is the cause of the type 2 diabetes. So to reverse diabetes, you have to reverse the obesity. This is the risk factor or biomarker analysis from that same Hallberg paper, Banpuri 2018. And if you look at all of the factors, the weight, hemoglobin A1C, blood pressure, triglycerides, ApoB, ApoA1, and you look at the direction that they went, everything gets better on average, except the LDL cholesterol, the calculated LDL cholesterol. But everything else gets better. And yet I still have people who come to me worried about that, and I'll get to that in a second. So in summary, the keto diets, low carb diets, reduce the metabolic syndrome, which is high triglyceride, low HDL, high abdominal circumference, high blood pressure, high blood glucose. And the keto diets reduce the metabolic syndrome better than low-fat diets. When you look at it in the big picture, we're just using something that Jerry Reven talked about at Stanford many years ago, and it was replicated and then it augmented by Jeff Volek, now at Ohio State University, where the keto diet addresses the metabolic syndrome, not the total cholesterol and LDL all the time. Although 2/3 of the time, everything gets better, and even the total and the LDL. But 1/3 of the time, the LDL doesn't reduce, as you might expect. Most commonly, the size of the LDL changes from small to large, but not all the time. But the way I look at it is that the keto diet addresses the metabolic syndrome, which is just another way to go about cardiometabolic risk reduction. It's not wrong or bad, it's just different. The American Diabetes Association Nutrition Panel had a paper last year supporting the use of the low carb diet for the treatment of diabetes. In fact, in there they say that low carb diets lower the blood glucose better than others because the glycemic index, the effect on the blood glucose is lower if you lower the dietary carbohydrate. So it's even in the American Diabetes Association guideline recommendations. At our clinic at Duke, for now about 13, 14 years, we had an analysis, a quality assurance analysis, and this is what we found. We helped 26,000 pounds come off 2,000 patients over this five-year period. There's no expectation for you to prove in your office that the blood pressure medicine works, because you see the blood pressure get better. It's pretty fascinating that people expect or still don't believe the keto diet works for weight reduction, but if you're a clinical doctor using it, you see it every day. Why do they have to prove it again? The studies have been done. We've treated lots of different types of diseases, including obesity and type 2 diabetes. The use of the diet for these other conditions is not at the level of FDA approval in terms of studies, but I still use it anyway with monitoring at Duke. Wouldn't you like to have this kind of effect in your patients? This is Janet. She lost 130 pounds, eliminated all of her medicines after a decade of diabetes, and it was the branch point of the doctor wanting to put her on insulin, where she said maybe there's a better way. And she found the doctor who used the keto diet now has a normal hemoglobin A1C, off medications, and lost a lot of weight and is keeping it off just by changing the food. No pills, no products, no surgery. It's pretty amazing. So your patients, your friends, your fellow doctors ask you to watch this video. I'm at Duke, ewestman@duke.edu is my email. I have an open door policy if you want to come visit, and we'll arrange a time. It took me visiting Dr. Atkins' office in 1998 to convince me that I should do research on it. I didn't start using it in my own clinical practice till about 10 years later. So I hope to influence lots of other doctors to use this. There are a growing number, and I wanted to make this video short and sweet and just intrigue you, get you more interested in the keto diet. I'm Dr. Eric Westman, and until the next time.